There's a CDC meeting happening this morning to discuss new COVID isolation guidelines. Leading the discussion is Dr. Amesh Adalja with Johns Hopkins Center for Health Security and has agreed to join us on his break. Thank you so much for taking time on such a big day. Nice to see you.
Thanks for having me.
Well, currently there is a 5-day isolation period for anyone who tests positive for COVID-19. We're told to stay home, stay away from everybody, but this could change?
Yeah, there has been some speculation about the CDC changing its guidelines to make it sort of align with the same guidance we have for influenza and for RSV, which is that you stay home until you're fever-free for 24 hours without any fever-reducing medicines. And this is what's the current status in California, Oregon, and many other countries. And I think this was a predicted change based on where we are with COVID.
And that's what we've always heard to do for other illnesses. So is it fair to say that COVID-19 isn't as dangerous for us as it used to be? Maybe we've all built up a tolerance to it?
Well, it's definitely less dangerous than it once was. It's not crushing hospitals. We don't see the number of deaths that we once did. And we have a lot more tools in terms of vaccines, home tests, antivirals, wastewater monitoring, more tools than we have for any other respiratory viruses. So it's become more manageable. That doesn't mean it's gone away. We still know that maybe 1,500 people die every week from COVID. That's still too high. These are preventable deaths. But in terms of its ability to disrupt lives and disrupt healthcare systems, and the fact that we have tools, we have immunity in the population, that I think allows the CDC to have this ability to reevaluate where we are and try and integrate the guidance for all the respiratory viruses like Oregon and California have done and many other countries have.
I'm just wondering what your thoughts are about any changes that people may feel about COVID in general about this, because if the CDC says isolation isn't necessary, people may not take it as seriously. Are you concerned that fewer people will get vaccinated, especially older Americans who are really encouraged to get it?
It's important to say that nobody is saying isolation is not necessary. What we're doing or thinking about doing is that what they're thinking about is truncating that period to make it aligned with other respiratory viruses. That doesn't mean you go out and spread the viruses. So it's not all or nothing. It's saying when you're most contagious, when you have that fever, that's when you need to be staying home. After that, the CDC is going to recommend, likely, like other states have, that you wear a mask when you're around people. So it's not as if there's no isolation. It's really adopting a harm reduction approach, trying to make sure people are isolated during the period of time when they're most contagious. And we know people aren't following that guidance. So we want to make guidance that people will actually follow. That's part of what harm reduction is about. And I think it's important that people remain vigilant and they still realize that COVID-19 is still killing too many people. It's still hospitalizing too many people. And we have too many tools that are sitting on the shelves, like drugs like Paxlovid and updated vaccines for high-risk individuals. People still need to be using those. We need to get the deaths and the hospitalizations down even lower. But I think that we're at a point where we have the tools to do that. And we have enough immunity in the population that COVID isn't the disruptive force that it once was. And that's why people are revisiting guidances.
Now, a study out just this week and funded by the CDC says the COVID vaccine slightly increases a person's risk of heart, brain, and blood disorders. So how are you feeling about the vaccine right now?
I'm feeling very good about the vaccines. These are rare side effects that really are very minuscule in number compared to the benefit of what the vaccines have done in terms of lives saved. And when you look at that report, a lot of the side effects that people talk about there were with the AstraZeneca vaccine, which was never even approved in the United States. And when you look at the mRNA vaccines, which are the bulk of what people have gotten vaccinated with, the Moderna and the Pfizer vaccines, the myocarditis is the risk that we've known about, which is a mitigatable risk and one that is something that's not very serious in terms of adverse health consequences that are long-term. So all vaccines have risks, and I think when you look at this data, it should reassure people that these are rare side effects, mostly tied to the AstraZeneca vaccine, which was never used here, and pale in comparison to the benefits that the vaccines have provided. That's why we're talking about guidance changes, because the vaccines have provided so much immunity that COVID is not this force that it once was.
Especially if you're talking about thousands of people dying every single month from COVID still. All right, Dr. Adalja, thank you for taking time from Johns Hopkins and in the middle of such a busy day. We appreciate talking to you and getting your expertise.